Okay, just phoned in. Hi, my name's Carissa. I'm going to be doing a cardiopulmonary assessment on you today. Can I get your first and last name?
Brooklyn Perry, and
your date of birth?
March 22nd, 2000.
Perfect. All right, looks good. Do you have any allergies I should be aware of today?
No.
Okay, so we're going to be doing a cardiopulmonary assessment today. I'll be touching and palpating you in some places. Is that okay with you?
Mm-hmm.
Okay, perfect. So upon general assessment of the patient, she's showing no signs of cyanosis or pallor, no sign of labored breathing or use of any intercostal muscles. Her breathing is also even. Her hair is well groomed and well maintained. She doesn't appear to be in any pain or discomfort, and she appears to be her stated age. All right, Brooklyn, before we get started, can I ask you a couple of questions?
Yeah.
All right, have you ever been diagnosed with a congenital heart disease?
No.
Have you had any surgeries on your heart?
Nope.
Okay. Are you on any medications that may interfere with your heart?
No.
Okay. How often do you exercise?
About 4 times a week.
Okay. And what do you do when you exercise?
I'll usually do some sort of running or weightlifting, or maybe a combination of the two.
Okay. What's your diet like regularly?
I tend to eat a lot of vegetables and grains with some chicken mixed in there.
Okay, sounds good. What about alcohol intake?
If I do drink, it's very minimal. I'll usually maybe have like 1 or 2 drinks a week.
Okay, sounds good. And finally, do you or have you ever smoked?
No.
Next thing I'm going to be doing is listening to some of your heart sounds. We're going to start with your left side, which is your pulmonic valve. We'll go 2 intercostal spaces down. S2 is greater than S1. Go to the right side in the aortic valve. S2 is greater than S1. It had an even rate and rhythm, and I didn't notice any signs of extra heart sounds or murmurs. If we did, we would go through the rest of the heart and listen to different areas of the heart for that. S2 is greater than S1 on those 2 spots because that's where the aortic and pulmonic valves are closing. The next part of the assessment, I'm going to have you stand up and turn around, and I'm going to be listening to some of your lung sounds. Every time my stethoscope touches your back, can you take a deep breath in through your mouth?
Yeah.
Thank you. Okay, her lungs are clear to auscultation, showing no adventitious lung sounds. I don't hear any crackling or wheezing. If I did, that might be a sign of pulmonary edema. Sounds good. Next part of the assessment, we're going to be moving on to palpating and inspecting her chest. First glance of the chest appears to be symmetrical, no signs of her chest appears to be symmetrical and no signs of any disformities. She does not appear to have any scars on her chest from any previous surgeries or placement of any pacemakers. Her AP to transverse diameter is 2 to 1, which is normal and what we would want to see. So the next thing I'm going to be doing is palpating her upper arms. Okay. Are you having any pain?
I'm not.
Okay. Her skin is warm, dry, intact, showing no signs of skin breakdown on her elbows either, which is good. Her skin is evenly pigmented and evenly distributed throughout, appropriate for her ethnicity. The next thing I'm going to be doing is feeling for her radial pulses. Okay, and we'll do the same on the other side. Okay, her pulses have an amplitude of 2+, are evenly bilateral, symmetrical on both sides, and have an even rate and rhythm, which is good. And the next thing I'll be feeling is her brachial pulses. Okay, and move on to the other side as well. Okay, those are 2+ as well and evenly bilateral. The next part of the assessment will be on your, the next thing I'll be doing is checking your capillary refill on your fingernails. Less than 2 seconds, showing good perfusion on what we want to see. Okay, the next part of the assessment, I will be palpating her lower extremities. Let me know if you have any pain, okay, Brooklyn?
Okay.
No pain?
Nope.
Perfect. So her skin is warm, dry, intact, appropriate for her ethnicity, and is showing no sign of any skin breakdown. The next thing I'll be doing is feeling for her anterior tibial pulse, which will be on the inside of her leg. Okay, the next thing I'll be doing is feeling for her anterior tibial pulse. Okay, and on the other side as well. Okay, those are 2+ and evenly bilateral. Next part, we'll be moving on to her feet, and next we'll be feeling her dorsalis pedis pulse on her feet. We'll start with this foot. We'll go to her second toe and move up a little. Okay, check the other side as well. 2+ and evenly bilateral. If we couldn't find those, we would use a Doppler to try and find them. Finally, we'll be checking for her capillary refill on her toes. That's less than 2 seconds and what we would want to see. Do you have any questions for me today, Brooklyn?
No.
Okay, thank you. That concludes our assessment.